Cognitive Behavioral Therapy Simplified, the complete CBT techniques and tools for managing emotional and anxiety disorder, and how to treat depression with CBT in children and adolescents. Written by Dr. Dale Pheragh, narrated by Micheal Borge. Preface. The CBT Guide for Children and Adolescents gives you the resources to help the children in your life handle their daily obstacles with ease. Inside this workbook, you'll find hundreds of worksheets, exercises, and activities to help treat emotional and anxiety disorder, teenager CBT, treating depression with CBT, happiness and addiction recovery with CBT, CBT exercise, cognitive distortion, 9 CBT techniques and tools, and more. The author wrote this book with decades of experience working with kids, teens, adults, and these practical and easy-to-use therapy tools are vital to teaching people how to cope with and overcome their deepest struggles with cognitive behavioral therapy with step-by-step instructions, and see how the best strategies from cognitive behavioral therapy are adapted for children, teens, and adults. Free bonus. Are you passionate about reading and adding new value to yourself? Would you love to get various free and discounted books delivered to your inbox courtesy of Enjoy Publishing House? Get access now or visit enjoy.com book deals. Other books by the same author? Before we proceed, I'd like to thank you for downloading and buying this book. I believe this information will impact your life significantly. Please find below other books I've written. They are meant to be impactful. Allergy and asthma relief. Number 1 straight-to-point solution for managing asthma attack symptoms, signs, and causes in children and adult. Allergy No More, the concise solution for managing symptoms, signs, and causes of drugs, food, insect, latex, mold, pet, pollen, skin, and dirt allergies for kids and adults. Anxiety and Phobia Crush, summarized approach to combat anxiety and regain your life. Asthma Relief, the summarized fail-proof asthma attack care therapy. Visit the Follow the Author's page and see all other books by the author. Amazon.com, author Dale Pheragh. Introduction. What's cognitive behavioral therapy? Cognitive behavioral therapy, CBT, is a kind of psychotherapy that is utilized as an initial line treatment for several psychological and behavioral problems. Is it an evidence-based therapy that has proven effective in dealing with depression, stress, eating disorders, drug abuse, and a great many other mental disorders and behavioral problems. CBT is dependent on the knowledge that modifying maladaptive thoughts can result in positive changes in feelings and behavior. Its primary concentration is on your client altogether, rather than specific disorders, to be able to recognize what thoughts and actions have to be fixed. So how exactly does CBT help? In CBT, therapist helps your client or band of clients to recognize current emotional and behavioral problems and change the thoughts and behaviors that cause them. Cognitive behavioral therapy pauses maladaptive thoughts, known as cognitive distortions, exacerbate and intensify psychological behavioral issues. Cognitive distortions are exaggerated or irrational thought patterns that perpetuate unpleasant feelings, such as panic and depression. A typical exemplary case of a cognitive distortion is catastrophizing. Individuals who catastrophize expect the most severe to occur at every change or exaggerate the need for insignificant occasions. Catastrophizing leads us to think that things are much worse than they are, resulting in extreme dread and impaired decision-making. CBT helps your client by teaching them new and far better ways of considering themselves, their environment, and current, recent, and future life occasions. A client that is susceptible to catastrophizing would first be trained to note when the catastrophizing thoughts start to surface. Anxiety and stress are mitigated by considering other possible results and making a variation between a distressing event and a catastrophe. CBT also aids your client in developing skills for effectively dealing with stress and other life difficulties. Chapter 1. Cognitive Behavioral Therapy. What you ought to know. Cognitive Behavioral Therapy, CBT, is a kind of talk therapy. CBT helps kids and teenagers take a look at their thoughts, emotions, and behaviors. CBT is a good idea for kids with ADHD, anxiousness, depressive disorder, and other issues. Many kids with learning and attention issues likewise have mental medical problems. The most frequent are ADHD, stress, anxiety, and depression. There are a variety of treatments for these and other psychological.
Sample complete. Ready to continue?